Cheryl Erickson, and I'm the Indigenous focused ECE instructor with Louis Riel Vocational College. Today in Nutrition and Health and Safety, we're going to discuss Chapter 12, Children's Mental Health. But before I get started, I just want to remind you to read Chapter 12, as this video is not a replacement for your daily readings. So just as we get into Chapter 12 and the topic of mental health, I just want to reiterate and expand on maybe the term mental health. And we're going to not think about that, but maybe more focus on the emotional side of children and where they are developmentally. So when I say that, most children, as they're learning and growing and developing, self-regulation skills are things that need to develop, and they need to learn how to express their emotions appropriately and learn the appropriate emotional responses to things. And so that is basically how we're going to define this chapter and how we're going to look at children. So more managing those emotions. And so how do we develop our first emotions is through those secure attachments, those in relationships that make infants feel safe and secure. As well as learning and experiences in life that make you feel settled and safe, those healthy types of experiences that we need to have in order to move forward in a positive way. The continuum of health is a range of behaviors associated with positive social and emotional development, as well as it suggests mental health and mental illness. But again, I want to focus on, we're looking really at here the preschool and school age side of children and their development, and how those emotions and self-regulation develop. When do we need to talk to the parents about self-regulation and emotions is where I'm going with this, and how we have those conversations that maybe they need to talk to their pediatrician. We've noticed developmentally this is happening, and have you talked to your doctor about it? And that's kind of where supports come into place. Emotions and self-regulation development is very different for each individual child, because again, we look at each child as a unique individual. And so we look at not really their chronological age as far as development, but more so where they are developmentally and initiating those developmentally appropriate practices. So when we look at, managing those ranges of emotions, some things can be hereditary. Temperament is sometimes a hereditary thing. They get their personality for grandpa. It took him a while to warm up. Or grandma, that difficult type of behavior. That's all, pretty part and parcel of some personalities, and children develop that way, and their personalities could be that way as well. It could be sense of humor, a dry sense of humor, and some people laugh at everything. So those are personality styles, and often we get that from, we can get that from somebody else as well. Physical and health can attribute to that whole emotional style of development as well. Premature birth, again, you're going to develop at a different rate, and self-regulation and emotions can develop later as well. I can tell you through experiences in working with children, and say, for example, I'm thinking about a 5-year-old boy that I worked with that was amazing cognitive, physical development. He was above the normal range for development. He could problem solve. If there was a problem going on, he could literally solve it like I could. He would offer them suggestions. Do you think you could do this? Do you think you could do that? And it was amazing how articulate and how intelligent he was. But I can express to you that something as simple as his mom putting butter on his sandwich when he asked her not to, he could have an emotional breakdown. And so what I'm saying is, emotionally, he wasn't developing at the rate he should. That was a little bit delayed. But cognitively and everything else, he was far above his developmental range. Some things just develop a little bit slower, and there's nothing wrong with that. We just have to properly guide and help where we can. Diet is often, could be an issue regarding how children behave. And how your brain is developing. So maybe there is some kind of cognitive delay or damage that may have damaged or affected your ability to regulate that self-control. And that could be a lifelong type of issue as well. Some things are irreversible, and we just work at trying to provide the skills that we can. So how does environmental factors influence us when you think of, where we are mental health, where we are social, emotionally, how we respond to things around us? Sometimes family life situations can be a big impact. So if you're feeling insecure and you need a specific routine to follow, consistency, you don't have a consistent bedtime, you're not eating at a consistent time, do you think that would impact a child's ability to self-regulate and control their emotions? Absolutely. If you don't have a set bedtime, you don't often eat breakfast, things like that are really going to impact how you feel, and how you feel is our emotions. So those have big, impacts on life. Feeling good about yourself, the community of well-being, environmental toxins are in factors as well, can affect your health, and you not be able to feel good. If you're not feeling good, you're not at your best, and that is going to affect you emotionally and how you manage the situations around you. All big impacts for young children who are still in the process of developing those skills. So we have talked in past chapters about infants and how they develop, how important those early attachments are for them, separation anxiety, things like that. So really, infants go through stages of development that we're gauging that they're developing normally. So one of the first things that an infant will do is a social smile. So you smile at an infant and they smile back at you. That's a social smile. And that is pretty typical normal infant development. Initiating movement and facial expressions, you're doing it, they're copying you, pretty normal infant development. Expressing communication with face and body, you're talking to them, often their lips are moving and they're making the body language to express that back to you. That's the start of learning communication. So they're responding to you when you're talking and playing and initiating things. So those are normal signs of how an infant is growing and developing. If for some reason you notice that isn't happening, that is something I would have a discussion with, a pediatrician about. Why isn't that happening at this particular age? And they are the expert, and so they're going to guide you on what you can do, or maybe who you could see. Maybe a referral will take place. So we've talked about the infants, and now we're moving to the 1 and 2 year olds in terms of health and healthy social, emotional development. Again, imitating behaviors of others is something that's pretty common in that 1 and 2 year olds, you clap your hands, they clap their hands. You can do a lot of finger playing and singing, and they usually follow suit. Being aware of themselves as separate from others and excited about being with other children is really something that's common. A child at this particular age will recognize themselves in a mirror, and they'll make faces and things like that, and they realize that it's not somebody else in that mirror, it's me in that mirror. That's a normal progression of development, where a young infant wouldn't understand that that's not them. So things like that are normal steps in development. And then that ability to start with being more autonomous and building that independence. And typically at 2, we get into the defiant behaviors. They're really exploring their environment. They're getting into things that we don't necessarily want them to get into, and the word no appears. And so that's often you ask something of them and they say no. And no becomes the defining word of a particular 2-year-old. So again, if a child isn't progressing normally here, again, that would be that conversation that you're going to have with a 2-year-old or a pediatrician in terms of normal development. And I'm worried, I have concern, because they're showing more separation anxiety. They have this fear that I'm going to disappear. And they're, 3 or 2.5 when that should be done with, or they don't seem to be interested in other children would be a really common one, and often associated with that autism, because they don't see children as other children, but more so an obstacle in the way. 2-3-year-old healthy social emotional development, very independent. Individualism is a huge part of that growth and development. Lots of memory. They recall things so much greater and will remind you of things, or know where certain things belong, or will go get their favorite toy off the shelf because they remember where that was. They're growing more socially. They're developing friendships and common interests, and they have progressed in that development of sense of right and wrong. So those are gauges, of a healthy social emotional development for that particular age. 3-4-year-olds, for that healthy social development, they are really exhibiting interest in interacting with others, with their friends. Friends become so important to them. They're developing a really good relationship with the adult around them, the ECE. Typical 3 to 4-year-old child, my experience, when children arrive at the daycare, you're saying good morning to them. A typical 3 to 4-year-old will seek you out and say good morning to you if you don't see them first. That's a really good sign of a healthy social development, when they start to seek you out and they're playing those social roles. Using language to communicate wants and needs. They've got a really good grasp of language at that age. Ability to manage emotions and behaviors, to follow rules. Rules are very important to a 3 to 4-year-old child as well, and they want to please, so they're really big on being your helper and doing things for you. They like to please you, and they like that praise of a job well done, and they feel good when they do a job. Fantasy play is big for them as well, so they're really doing a lot of role play and a lot of fantasy play. They're really good at it. 4 and 5-year-olds, healthy social and emotional development. Their attention span is much greater as well, so they're able to focus on social interactions a little bit longer. They're able to take on leadership roles. They have a good understanding of perspective taking. So they've reached that stage of development, so they see how other people are feeling within that. They're able to build projects, focus on projects. That has a lot to do with their attention span, and they have a greater ability for imaginative play. So again, those are very important parts of that normal emotional development, and knowing how to respond to things emotionally is really important also. And so if you're noticing that that's not progressing and you have cause for concern, I would have a conversation with a parent as well, and really be mindful about how you have that conversation, because those conversations should be tactful, and I would always start with some really positive things that I've noticed. And have you noticed this? Did you find that the child usually responds this way when this happens? Have you ever talked to the doctor about that? So really being kind and tactful, and then always end on a positive note too. I was amazed when he was able to climb to the top of the climber today. So there's always lots of positives that you can put into practice as well, because that makes the parent feel good as well. What do we do as ECEs to create that supporting environment for that particular child? If we always want to ensure that all children are feeling welcome and comfortable in our program too. So make sure that setting, that environment that the child is coming into, is really welcoming. You should always be saying good morning and I'm so happy to see you, and things like that, to make that child feel good and really be tuned into the child's development. Doing developmental checklists throughout the year is a really good handy tool. I really like my groups by age. It can be very handy, because you can see if I have a group of 4-year-olds where they are developmentally. It's a good measurement tool as well, and they can develop some skills from each other. It's really, it's really important too. You can have some scaffolding happening there to help children meet those milestones. Make sure your setting is one that children are feeling safe and secure. And how are you doing that? It's part of developing that relationship and making those children feel comfortable. Labeling emotions, telling them emotions are okay. Just understanding about that child, their family, and where they are. Lots of opportunities for the child to be self-sufficient. Free play is great. They can choose where they want to play, with who they want to play with, and we can be a part of that play and teach them roles within that play as well. As well as you want to ensure that you're providing age-appropriate activities so that they are being successful in what they're doing. So really good nurturing relationships for that child establishes a positive rapport with you and the child. Make sure that you're programming for that child with things that are interesting to them. The more they are interested in that, the greater they're going to participate in those activities. Recognizing their strengths and building upon that, as well as where you can challenge them, is really important. Lots of communication, set some limits, be positive. Rules are really important too. Know that, rules have consequences as well. That's all a part of teaching practices too. So support and care for children daily, and especially when there are some challenging circumstances. You need to guide them, you need to help them, and sometimes give them the words to use and check those emotions as well. What is providing appropriate play for children, especially preschool children, is really unstructured. So lots of loose parts contributes to cognitive, physical, creative, expressive, social, emotional development. Children are freely moving through the environment, and they're choosing where they want to play, choosing what they want to play with, who they want to play with. Really important. We want to allow for opportunities for them to use their imagination, explore, practice their dexterity, gain mastery with things. Again, I can't say enough about how effective loose parts are within free play. And so I've said loose parts a couple times. We will talk about loose parts in the videos. Not in health, safety, nutrition, but we will get to loose parts, and you should have a basic understanding of what that is at this time. But it does provide a lot of opportunities for them to be creative and freely play and explore things in their environment. And it does lead to a lot of good social skills opportunities for the children. So that does conclude this video on Chapter 12 in Nutrition, Health, and Safety. Please do see your instructor if you have any questions or need further clarification on anything, as well as to check in to ensure that you haven't missed any handouts or assignments pertaining to this chapter.